what really happens when we have a migraine attack?
It's a vicious cycle that kind of rolls down the mountain like a snowball and gets bigger and bigger.
How do I know that if I'm having a headache or a migraine?
The difference between headache and migraine is really
Mhm.
based on the intensity of the pain.
Women get migraines during menopause while others do not.
If you talk to women with a history of a migraine and you ask them, when did they start, they will very often say when I was 11, 12, or 13 years old.
And like, what are the 5 lifestyle changes that a person can do to prevent from migraine or headaches? Hello friends, welcome back to Podcast with Shilpa. Migraines and headaches are some of the most common problems people face today. Yet many of us still don't understand the real reasons behind them. To help us uncover the true causes and the right treatments, we have with us Dr. Spierings, a migraine specialist and the author of a best-selling book on headaches. And if you haven't subscribed to my channel yet, please do it. It really helps and you will get more such informative conversations. Let's get started. Hello, Dr. Spierings. Thank you for being on my show, Podcast with Shilpa. Today, I am excited to learn about headaches and migraines from you.
Thank you very much, Shilpa, for having me. It's a pleasure and a privilege.
So, before we dive in, I would like to ask you, how do I know that if I'm having a headache or a migraine?
The difference between headache and migraine is really based on the intensity of the pain. I think all of us get what we refer to as regular or ordinary headaches. People may call them tension headaches. And these are mild to moderate headaches, or low-grade intensity headaches that, may last a couple of hours and are easily relieved with rest, relaxation, maybe taking an over-the-counter pain medication. And that is very different with migraine. First of all, these headaches are intense. They're either moderate or severe in intensity, and you don't really get too much of any benefit from over-the-counter pain medications. So I think if you do have headaches and you take the over-the-counter pain medications and it doesn't really provide you with good relief, you have to assume that you have migraine, and you would do much better taking specific medications for that condition, which fortunately we have.
Mhm. So, what really happens when we have a migraine attack in our head?
Yeah, of course, honestly, we don't know that uh, to the full extent.
Mhm.
People have different thoughts about it. I myself am a firm believer that the migraine mechanism relates to opening up of blood vessels in the head, which
Mhm.
subsequently become inflamed.
Mhm.
The inflammation is not your regular kind of inflammation that you may see with an infection, but it's inflammation that's caused by the stimulation of the nerve fibers that are specifically involved in pain. We call that neurogenic inflammation. So inflammation that comes out of nerve fibers. Once these nerve fibers get activated, they release certain chemicals, in this particular case, around the widened blood vessels, which makes these blood vessels extremely sensitive to pain. So I think it's a combination of opening up of blood vessels in the head and these blood vessels becoming inflamed. And it's a vicious cycle that kind of rolls down the mountain like a snowball and gets bigger and bigger.
Mhm. And like, why do some people get headaches every day, but some really do not?
I think pretty much all of us get headaches, and then I'm talking about regular, ordinary headaches, tension headaches. I think all of us do tend to get those headaches every so often. I always like to say that people who deny ever getting headaches probably have bad memory,
Mhm.
because headaches are so common. If you have headaches that are either intense or frequently. And about the intense headaches, we just talked about migraine, which is by far the most common reason why somebody would get intense headaches. Frequency of headaches is also something that always needs another explanation.
Mm-hmm.
And that can be a medical condition. For example, it's known that low thyroid function, hypothyroidism, can be associated with daily or almost daily headaches. So that's always something I look at. But also other medical conditions can do that, can give somebody a daily or almost daily headache. So I think that that is a condition like migraine that really deserves medical attention, and people should be looking at that. I like to emphasize that because of the fact that when you have headaches every day, people very often link that and have done so also in the past to depression.
Mm-hmm.
And I could certainly imagine that when you have headaches daily or almost daily, depression is probably the result of that, but it's not the cause of daily or almost daily headaches. So that's very often assumed that that's the reason why, but I think that that is a wrong assumption that doesn't do patients any good.
Yeah. So, what are the five foods that trigger migraine or headaches?
Yeah, first of all, I think more important than diet or specific foods, I think it's important that people don't go without food too long,
Mm-hmm.
and that especially also goes for fasting. Going without food too long, especially fasting, is certainly a very common trigger
Mm-hmm.
of headaches, including migraine headaches. So that's really what I like to emphasize to patients when they ask me about diet or about food, that it may be more important that you eat regularly, that you don't go without food too long, than particularly what you eat. However, when it comes to foods, I do like to talk to patients about alcohol, which is not really a food,
Mm-hmm.
but alcohol tends to be a bad trigger of
Mm-hmm.
headaches as well, especially migraine headaches. And I'm not talking about hangover headaches, but migraine headaches that occur as a result of the consumption of alcohol. Alcohol is a relatively potent vasodilator,
Mm-hmm.
a widener of blood vessels. And I think with regard to alcohol, it's particularly the case with red wine. Red wine
Mm-hmm.
um, contains a lot of products of fermentation, congeners, they're called, like histamine, for example, tyramine, and these are also biologically active substances that can interfere with, that can interact with headache in a negative way. Um, the second one would be caffeine. I like to tell patients not to drink more than, if they drink caffeinated coffee, not to drink more than 1 or 2 cups a day, and if possible, drink decaf only. And of course, that also goes for sodas. And then lastly, cured meats.
Mm-hmm.
Cured meats tend to contain nitrites and nitrates, and these are also chemicals that open up blood vessels. So anything that kind of has an impact on blood vessels certainly can trigger headaches, including migraine headaches.
And does like skipping breakfast, will it lead to headaches?
Yes, skipping any meal, but maybe particularly breakfast because people haven't eaten at that time for maybe 10 to 12 hours. So that certainly further extends the time that somebody goes without food.
Mm-hmm.
Um, I strongly recommend, if you're prone to headaches, especially if these headaches are intense and you may well have migraine, that you should eat regularly, if possible, 3 meals a day. I can't emphasize the importance of that. I think people do very often focus on what they eat, on diet, which takes a lot of time, effort, and sometimes also money to kind of regulate that. And I think it's much more important to stick to regular meals, if possible, 3 times a day. Eat regularly and definitely stay away from fasting. Sometimes people do fast for religious reasons, but I
Mm-hmm.
think having migraine is a very good medical reason not to do that, because you end up generally, or very often, you end up with a very bad headache when you do that.
And stress or lack of sleep, which can cause or which can trigger more headache.
Yeah, so when you talk to headache, when you talk about headache, including migraine, people very often do mention stress. Um, because of the fact that everybody talks about that, I tend not to talk about it
Mhm.
because I think other factors are certainly equally important
Mhm.
to stress. And the other issue is that I, I'm kind of a practical person. I like to talk about things with people, with patients in particular, that I or the patient can do something about. And stress is generally not something that people can address very effectively.
Mhm.
I can't even take care of it in my own life. And I find it very hard to ask patients to take care of it in their lives if I can't even take care of it in my own life. But I like to emphasize on things like fatigue. You mentioned that as well. I think fatigue is extremely important in the context of headache. In fact, I think that people very often ask me, why do people get headaches to begin with? What is that? Is it, a stress response or something like this? And I would like to tell people, no, it's not. I think the biological function of headache relates to fatigue, not to stress. If you feel tired and you don't listen to your body and you don't pay attention to that, headache, I think, is the next complaint or symptom that will follow and will force you to take a step back under those circumstances. And I think fatigue is very often related to lack of sleep. Headache is extremely common, but problems sleeping even much more so. I'm really impressed when I talk to people, including patients, how often they have issues sleeping, falling asleep, sleeping through the night, waking up early. It's not uncommon for people to have only 3, 4, 5 hours of sleep per night. If you don't get enough sleep at night, you feel tired, and as a result of that, you certainly can get headaches, including frequent headaches. And I mentioned earlier that you can have frequent, if not daily, headaches from a medical condition that is referred to as hypothyroidism or low thyroid function. As you may know, thyroid regulates energy metabolism. And I think the reason being that if you have low thyroid function, you tend to feel tired a lot. And I think that fatigue then causes you to have headaches. And if you feel tired all the time, don't be surprised that you have headaches every day or almost every day. And I think people tend not to see that. Again, as I said earlier, people very often think, or physicians will say that to patients, you have headaches every day. Are you depressed? Or are you stressed out? But they never ask the question, do you feel tired all the time? Don't you sleep well at night? These are the questions that I would ask those patients.
And what are the 3 things one should never do during a migraine?
First of all, you have to recognize when you're a migrainer and when you feel the onset of a headache, that is going to be a migraine headache. I find that people tend to be very optimistic, which I think in life is good in general. But they may say, okay, I have migraine, but this headache is not going to be a migraine. Or, the other side of the coin, they will say, oh, I just went through a bad migraine. That will probably be the last migraine ever. Both of these things are not true. So the first thing you have to realize when you're a migrainer and you feel the onset of the headache, you have to realize that you have to assume at least that that's going to be a migraine headache, which means that you don't want to postpone treatment. You also don't want to start off with using over-the-counter medications, especially if you have specific migraine medications available to you. And you also should take a step back, realize that you have headache for a reason. Very often that is fatigue, lack of sleep, not eating on time. So you need to take into account what causes those headaches and do whatever is necessary to address that. And then also, once the headache gets beyond a certain point, you want to go into a dark, quiet room, maybe lie down, maybe put cold on the head, put a heating pad on your neck and shoulder muscles. These are the kind of things that I think one should do. But I think most important in this context is to realize when you have migraine that whenever you feel the onset of a headache, that's going to be a migraine, and you need to treat and you need to act accordingly. That is, take your medications right off the bat and rely on specific migraine medications because those are the ones that generally provide the best benefit.
So is it safe to take the over-the-counter painkillers if you are having a headache?
I myself don't recommend that you do that, although generally people do that. I don't recommend that. When you have a mild to moderate headache, if you're not a migrainer, so that if you're not prone to having the intense headaches of migraine, and you have kind of the regular headaches only, mild to moderate headaches, it's much better to try to address that with rest relaxation. Maybe use a heating pad on your neck and shoulder muscles to try to relax your head, neck, shoulder, upper back muscles that mediate mild to moderate headaches, rather than taking pain medications. So address both the cause and the mechanism of those headaches. And when you have migraine, you don't want to rely on over-the-counter pain medications, because these medications do not provide the kind of relief that I like to see in patients. You know, when you have migraine headaches, these are intense headaches. They tend to be disabling. They make you sick in a general sense. I like people to get full relief of their headaches within 2 hours of initiating treatment, and that without side effects and also consistently. And over-the-counter medication certainly can give you some benefit when you're a migrainer, but not to that an extent. And initiating treatment of a migraine headache with over-the-counter medications only allows that headache to further build up in intensity, ultimately making it more difficult to treat with whatever you have. So over-the-counter pain medications, as far as I'm concerned, should not be taken for headaches in general, and should definitely not be taken for migraine headaches.
And like if someone has to take it due to some reason, then how many painkillers are safe in a day to take it?
I think the ones that you get over the counter, let's say aspirin, ibuprofen, naproxen, sodium, acetaminophen, or paracetamol. I mean, I think you can take those things several times in a day, provided what you're taking them for. I think the problem really is more the frequency. Once you take a pain medication for pain, you want to make sure you take enough so that you get relief. It doesn't make any sense just taking some pills and not getting any benefit from them. So if it's a legitimate reason for you to take those medications, those pain medications, I would take as much as you need to get benefit from it. But you don't want to do this on an ongoing basis. And the reason I say that is because, again, when you have pain, you need to try to figure out why that is and treat the cause of it, which is not always that easy, and especially when it comes to headaches. But also, most of these medications are not tremendously good on your stomach. You know, aspirin-like medications like NSAIDs, including ibuprofen, naproxen, sodium, these medications tend to upset your stomach, and that can, in it by itself, create a problem, especially when you take those medications on a daily basis or almost daily basis for a longer period of time. So again, you have to be careful doing that, and I definitely do not recommend that.
And like, what are the 5 lifestyle changes that a person can do to prevent from migraine or headaches?
First of all, I think it's important to realize that you're prone to headaches, and especially if you have a condition like migraine. I think a lot of people suffer from what they call bad tension headaches or bad sinus headaches. These things do not exist. If you have intense headaches that, let's say, disable you, or make it difficult for you to function, and at the same time may make you sick to the stomach, for example, and light and noise sensitive, you have to assume that these are migraine headaches. In that context, again, I would say fatigue is very important. Fatigue, when you have that, very often related to lack of sleep. So the first thing I would say is make sure that you get enough sleep at night. I generally think that people need 8 or 9 hours of sleep per night, but you also want to make sure that you go to bed in a timely manner, and you get up in a timely manner, because oversleeping is something that also tends to trigger migraine headaches in particular. Migraine headaches, although people very often look at them in the context of stress, they're really more relaxation headaches than stress headaches. If triggered by stress, they tend to not occur during the stress, but afterwards. For example, the weekends, a very prominent time for migraineurs to suffer from their intense headaches. So looking at, the amount of sleep you get, I think 8 to 9 hours is generally what people need to make sure you go to bed in a timely manner, get up in a timely manner, don't oversleep. And also try to spread out your activities during the day, especially if you're prone to fatigue, which some people are. They get tired easily. Make sure you spread things out over the day. You don't want to get exhausted from what you're doing, or spread it out over the week or whatever is necessary. And then maybe last, but also certainly not least, I would say make sure that you do eat regularly, that you don't go without food too long, that you do eat, let's say, 3 times a day, if that's at all possible. These are kind of things I would say in general. And then also, avoid alcohol. Don't drink more than, let's say, 1 or 2 alcoholic beverages at a time. Make sure you don't drink alcohol on an empty stomach. And pretty much the same with coffee, caffeinated beverages. Don't drink more than 1 or 2 a day. And certainly don't drink it on an empty stomach either, because when you take something on an empty stomach, it gets absorbed really rapidly in your system. And that certainly tends to make it more likely that you get negative impact of it.
And like, why do we always get an headache before an important event or an important work?
Yeah, why that happens? I think that may be the buildup from stress, or maybe from fatigue or exhaustion. Although I think it's more common, certainly with migraine, that people will have it after the event.
Mm-hmm.
For example, you've had a busy week,
Mm.
and then you end up with bad headache on the weekend. I think that's a much more common scenario, but you can certainly get headaches also during stressful events, including migraine headaches. And um, sometimes that needs to be addressed. For example, let's say somebody gets married, you don't want that person to end up with a bad headache on the wedding day. And for example, what I will do under those circumstances is I give the patient a short course of a corticosteroid like prednisone to make sure that that blood vessel widening doesn't trigger that inflammation that causes that migraine headache to take off and develop into a blooming headache. So there are things that one can do about it. I think that that's also an important issue that, people very often, at least that's what I see, live with headaches, including bad headaches like migraine, while there's a tremendous amount of things that we can do in medicine for them. So I think when you have either frequent headaches or intense headaches like migraine, and certainly when you have both of them, you should seek medical consultation. You should try to find treatment for those conditions, but also try to find an understanding of what's going on, that you either have headaches frequently or that you have intense headaches. Although, as I said earlier, when you have intense headaches, you can, readily assume that you have migraine. Just talk to some family members, because migraine is a genetically determined and inherited condition. It runs in families. And so you talk to your parents, maybe grandparents, siblings. They may well have similar problems as you do, headache problems as you do.
So, next we are going to talk about a very important topic, women's health. So, we are going to talk about the women's migraines and headaches because I feel most of the women's they don't talk about it. So, like for the menopause, so why do some women get migraines during menopause while others do not?
Yes. So first of all, let me tell you that women do tend to get headaches, including migraine, more often than men. That difference between the genders, however, doesn't start until the early teens. And that has to do with the onset of menstruation. And that also tends to be a very important time when migraine headaches start, in the early teens. If you talk to women with a history of migraine and you ask them, when did they start? They will very often say, when I was 11, 12, or 13 years old. You very often find the onset of migraine in women within a year of what we call menarche, the onset of menstruation. Another very common condition under which migraine headaches do start is pregnancy, believe it or not, very often after pregnancy rather than during pregnancy. And also the use of estrogen-containing birth control can certainly trigger the occurrence of migraine headaches. And very typically, these headaches that will occur during the week, if you take a cyclical estrogen-containing birth control for 3 weeks and then 1 week off, very often these headaches occur during the 1 week off, which may even prompt some people to say, including physicians, oh, that headache cannot be from the birth control because it occurs during the week you're off. But those headaches are triggered by estrogen withdrawal, so they typically occur in the placebo week on the day that you start with your bleeding. headaches tend to get better as one gets older, in women very often related to the onset of menopause. Now, you certainly also do have women who never have headaches and start to get them when they become menopausal. I think that very often has to do with the development of low thyroid function. Low thyroid function or hypothyroidism is very common. It affects about 5% of the population, so 1 out of 20 people, and it's much more common in women than in men, and it tends to start between the ages of 40 and 60. And I think very often the development of hypothyroidism impact the regularity of the occurrence of the menstrual cycle so that people think they're going into menopause, and at the same time may be a reason for people to get headaches, including frequent headaches or intense headaches like migraine, and also may develop symptoms that they typically think are menopausal, like fatigue or hot flashes or night sweats or things like that. So I think that a lot of women, in fact, have an erroneous idea about what is happening to them, let's say between the ages of 40 and 60. They think they are going through menopause and having all these symptoms as a result of that, whereas they may well be developing low thyroid function or hypothyroidism. And that is something that I always urge people to look at that very specifically, looking at what we call the TSH, thyroid stimulating hormone, but also at the free thyroxine level, FT4, to make sure that that is not the reason why these women go through those changes that, as I mentioned earlier, are often attributed to menopause while they are from low thyroid function.
So, what changes can these women can do in their lifestyle to prevent headache or migraines during their menopause?
The first thing I would like to say is don't go on HRT, hormone replacement therapy. I know that that has come up again recently. People are advocating that again for a number of different reasons, which I feel bad about, having dealt with headache for my entire professional life and trying to help people, especially women, dealing with their headaches and finding to find treatment for that. Estrogens in general are bad for headaches. That's also why women have more headaches than men do. These headaches tend to occur in relation to the menstrual cycle, premenstrually, 1 or 2 days before menstruation, mid-cycle at the time of ovulation, at the tail end of menstruation. These are 3 times within the menstrual cycle that women are most sensitive to headaches, including migraine headaches. And they should be happy once these estrogens get out of their system, once they become menopause. So as far as I'm concerned, even if you have symptoms that may be from menopause, don't go on to hormone replacement therapy. That may give you relief of those symptoms, but if you're prone to headaches, that is likely to make things worse and also take away from you the benefit that menopause brings to a condition, to a severe headache condition like migraine. A lot of women have issues with insomnia. We talked about that earlier, how common that is. They sleep very poorly as a result of menopausal symptoms like hot flashes and night sweats. And I think the better way to go about that is to try to treat the insomnia the best you can. Not so much with sleeping medications, hypnotics, we call them in medicine, because they tend to make you sleep dependent on it. But there are medications out there that can certainly be helpful. There's one called trazodone, for example, which is an old-fashioned antidepressant medication that doesn't really work as an antidepressant. But a medication like gabapentin may be very helpful for that as well. So I would like to say, if it's sleep that is bothering you, and that is kind of the problem that you're experiencing, try to get treatment for that. Because very often the other symptoms really relate to that. If you don't sleep well at night, you're going to feel tired during the day. You're going to have feel like you're in a brain fog. So ensuring good sleep, I think, will be a good way in the right direction to try to solve those menopausal symptoms. There are also over-the-counter things that I have found helpful for patients to treat menopausal symptoms as well. So you can always rely on those. That's fine also. But I'm a strong believer that going on to hormone replacement therapy is not the right thing to do. But I know that a lot of people think about that differently. And I know also a lot of women will get upset when I say that. But I still say it because I believe
Yes.
that to be true. And I just hate to see us going back to where we were maybe 20 years ago, where women almost felt obliged or were forced by their uh, doctors to go onto hormone replacement therapy for one reason or the other. I'm not a believer of that. No.
Mm. And is PCOS or hormonal imbalance the biggest cause of headaches in women?
So as I mentioned earlier, I think it's the estrogens that drive the headaches
Mhm.
in many women, and I think certainly in women of childbearing potential, so menstruating women, I think headaches are uh, more likely related to the menstrual cycle than not. And I always, if women do not appreciate that themselves, which I'm sometimes amazed about, that they haven't noticed that, or haven't made that connection, I ask them to keep a headache calendar, a daily headache calendar,
Mhm.
and that calendar also, on that calendar also, they need to keep track of the days of menstruation so that they can see if there is a relationship and what that relationship exactly is.
Mm.
Do these women have a hormone imbalance? Is a question that I have pondered for many decades, and I don't really have an answer to that. Some people believe that these people make excess estrogen, or they lack progesterone, which antagonizes some of the negative effects of estrogens on the body. Um, I think in some women that certainly is possible that they make too much estrogen. Uh, they tend to have other indications of that as well. For example, they have very long or heavy periods. Um, but there are also women who have a normal menstrual cycle, they have normal menstruation, and they still get migraine headaches related to the menstrual cycle. So is a hormone imbalance something that generally plays? I would say no, but it certainly can be something that plays a role in some women. But I think only in those who have issues with either menstruation, like long, heavy, painful menstruation, or who have issues with their cycle. Um, they don't menstruate frequently enough or too frequently, or they just have a very irregular menstrual cycle. So I think, um, you do want to see something wrong with that cycle to assume that there is a issue with hormonal imbalance. And it's certainly not the case in all women who have migraine headaches related to the menstrual cycle, because I've seen plenty of women with unremarkable periods and a regular monthly menstrual cycle.
And like we women's, we juggle up with so many things in day-to-day life, like managing home, kids, then work, then husbands. So, like, what is the biggest cause of headache for?
Yeah, you're absolutely right, Silpa, that I think women tend to pull the short end of the stick that way, especially nowadays when a lot of women and very often out of economic necessity need to put in a full day working outside of the home, and then also have the responsibility of all the work at home, taking care of the children, taking care of the husband. And I think that is very hard on women in general.
Mhm.
And may well be, I talked about insomnia as an important cause of fatigue, and I think this may well be an important cause of that as well. I think also in medicine, we don't tend to realize that sufficiently and give women enough credit for that.
Yes.
Absolutely true. The other issue that I would like to mention in this regard is that a lot of women struggle with their weight, for example, also.
Mhm.
Um, I think in general more so than men. And I think that very often relates to going through pregnancies
Mhm.
and the impact pregnancies have, for example, on your thyroid function. And again, you know, we don't look at that, I think, in the right manner. You know, we always think, you know, a woman may be too heavy because he or she eats too much or whatever, but we don't necessarily look at that in the context of what happened prior to that. For example, pregnancies, I think, are very important in that sense, and also the impact of that on the woman's body, in particular in terms of impacting thyroid function and causing hypothyroidism. Thyroid function increases during pregnancy.
Mhm.
Uh, to help the developing baby. And I think very often women end up after the pregnancy with a piece taken out of their thyroid function. And especially if you go through a number of different pregnancies, you
Mhm.
may end up with little thyroid function. And of course, that not only makes you tired, but also causes sweet craving and certainly also makes you gain weight. I think we just don't look at those things well enough. For women in particular. Absolutely, absolutely.
And is there anything natural remedy that women can do during their headaches or migraines at home?
You know, some things have been advocated, you know, magnesium,
Mhm.
vitamin B2. I don't think these things are really tremendously helpful under those
Mhm.
circumstances. I think if you have headaches, intense headaches, I think, again, you need to assume you have migraine. We have plenty of migraine-specific medications available, both to treat the headaches acutely or abortively, and also to treat them preventively. There are really no natural remedies out there that would help these kind of headaches. If you have them frequently, people generally have a lot of muscle tightness associated with those headaches. For example, if you see patients who have what we call chronic migraine, who have migraine headaches on a daily or almost daily basis, they invariably have very tight neck, shoulder, upper back muscles, also often jaw muscles. And
Mhm.
what I would recommend there, and it's very, very simple, is to use a heating pad on a daily basis. I like the microwavable heating pad the best because they give moist heat. And I tell people, use that heating pad on a daily basis. Put it on your neck, shoulders, and upper back. Use it for about 10, 15 to 20 minutes in the evening. And if you possibly can, do that also in the morning. When you use heat like that on a daily basis, that over time will decrease the tightness of those muscles. And also, by doing so, may decrease the frequency of your headaches, including migraine headaches. So that's the natural thing I would really like people to do who have headaches frequently and who find that they have chronically tight muscles. And the other natural remedy, really, when you have a particularly intense headache, is to use cold on the head. Cold is used just on an as needed basis. The heat is used preventively on a daily basis. So if you want to rely on natural remedies, I would say do that. Um, Vitamins, minerals, I don't think are going to be tremendously helpful unless there's a reason. For example, if you have migraine headaches from constipation, which sometimes happens,
Mhm.
magnesium citrate, I think, is a great mineral to take to help you with the constipation. Um, and I have seen patients who have headaches frequently, and for example, who are anemic and have an iron deficiency. And so, under those circumstances, you want to take an iron supplement. So,
Mhm.
there's certainly indications for vitamins and minerals. Talking about vitamins, could be vitamin B12 deficiency, folic acid deficiency. So, under those circumstances, certainly I would not only recommend, but in fact prescribe those minerals and vitamins. But I wouldn't just go out and do things on your own in the hope that you'll find something that
Mhm.
might be helpful for you. You
Mhm.
have to understand what's going on and know what you need to do to provide you with yourself with some relief.
Yeah, doing things on our own, it can lead to some harmful rather than doing good. right?
Yeah, I think so. And also people spend an awful lot of money on
Hmm.
all of those kind of things. I'm a Dutchman, and so we always like to say not only do we watch our own wallet, but we also like to watch other people's wallets. So when I see that, that really makes me sad. People, it's not just that, they put a lot of hope into these things that ultimately will not turn out, but in the process, they also tend to spend an awful lot of money. Don't do that as far as I'm concerned. If you want to do something for yourself, kind of try to get as best an understanding of why you have headaches, what is involved with them, and then act accordingly. But very often you do need medical help along with that because trying to figure that out on your own is not easy at all. Not easy at all.
And now coming to your book on headaches, first of all, I would like to congratulate you for this book, for such a wonderful book, amazing content you have shared with the viewers. And I would like to know what motivate you to write this book.
Yeah, so I have a copy of my book right here. Maybe I could show that. It's called
Yes.
Headaches, Why You Have Them, What You Can Do About Them. I have written about a dozen books, but all of them for the medical professional.
Mhm.
And I never really had the sense that I got anywhere with that. I don't have the illusion that anybody and anyone ever read any of those kind of books. So, but that's what I thought I was supposed to do, write books to educate my colleagues on headache and face pain. And this is the first and only book that I wrote focusing on the headache patient or the lay audience in a broader sense. What motivated me to do that? Couple of things. One is that I see that there's a lot of misinformation out there. As a result
Yes.
of that, there is a lot of misunderstanding
Mm.
of what headaches are all about.
Mhm.
For example, we talked about the relation of headache with fatigue, for example, fatigue with lack of sleep. Again, how migraine gets into it. If you have intense headaches, as I mentioned earlier, you kind of have to assume that you have migraine. Fortunately, we have great medications available for that. That's really the second reason that I wrote my book. I have a PhD in pharmacology, which has to do with the way medications work in the body. And with that background, I have been involved in the development of medications. I've been involved with all migraine medications that have come to market since the 1980s, or maybe even, yeah, since the 1980s, I would say. All medications that have become available for abortive or preventive migraine treatment I've worked on. And I like to say that we've made a tremendous progress. We've made tremendous progress in terms of developing medications that are safe, that are also across the board well tolerated,
Mm.
but very important also that work very well, that are highly effective um, treating migraine headaches acutely or abortively, but also that can prevent them over time. There are really three classes of medications that I focus on in my book: the triptans, gepants, and CGP antibodies. These are the three medications that I talk about a lot in my book. But my book also aims to provide people with general information about headache and face pain, by the way, and try to give them as good an understanding as we can provide them at the present time so that people understand. I find it very important as a physician that people understand to the best of their abilities what bothers them, what ails them. And I think that helps them cope with whatever is going on medically with them. So I think having an understanding is very important. I've always, been involved in education not only of my colleagues, but also of patients. I strongly believe in the virtue of that. Um, and that people know that we have those treatments available so that they can go to their physicians and, if not offered, maybe specifically ask about them and discuss the various treatment options with their physicians.
Mhm. And Dr. Sparings, in your book, you mention about myths about migraines. So, like, what are the two or three biggest myths that people still believe?
Uh-huh. I think that a big myth would be that migraine is a condition that only affects women. It
Mhm,
is certainly true that they affect women a lot more often than men, but it's certainly also a condition that men have.
mhm,
Men very often don't even think about the fact that they could have migraine because they think it's only a women's condition. I think another myth is the origin of migraine. I very strongly believe that migraine is a genetically determined and inherited condition.
mhm,
Um, and so, what you really need to look at when you have migraine is to try to get as best an understanding, not so much why you have those
mhm,
intense headaches. I think to get an answer to that question, it's good to talk to family members because migraine generally does run in families, but to try to understand what brings them on in women, especially the menstrual cycle, I would like to emphasize what brings them on and how can you most effectively treat them. So I think these are kind of the points that I think are
mhm.
important in general with regard to migraine.
Okay. And your book talked about warning signs of serious headaches. What should we look out for the most people miss?
Yes, we have certain what we call red flags when it
Mhm,
comes to headache. And I would say maybe number one would be um, a very abrupt onset of headache,
mhm,
like a blow to the head. In medicine, we call that a thunderclap headache. So you get kind of a headache from 1 second to the next. That is certainly something you can see with migraine, but it's very rare as far as I'm concerned under those circumstances. But it could indicate that you have a serious medical condition that's called a subarachnoid hemorrhage. And that is a condition that needs urgent medical care because unfortunately, a lot of people with that condition die from it. So that's really the first thing. The other one I would say is headache that is associated with other medical symptoms like fever, for example, but also neurological symptoms like headache associated with seizure. These things really should always urge people to get medical consultation. Headache is most common between the ages of 15 and 45.
mhm,
So headaches in childhood always need to be looked at with a great deal of concern, especially in very young children, like below the age of, let's say, 5 to 10 years old. As I mentioned earlier, women tend to develop migraine headaches in their early teens. So I'm really talking before the teens, and especially headaches that um, wake the child out of sleep at night or that are present on awakening in the morning in severe intensity. These are very concerning presentations of headache in childhood.
mhm,
And then on the other side, older individuals, as I mentioned earlier, a condition like migraine gets better as one gets older, which is a good thing. A lot of things in medicine get worse as one gets older. Migraine, on the other hand, tends to get better as one gets older, and that really goes for headache in general. So at an older age, certainly the onset of headache should be really also taken very seriously. And we're talking about conditions like subdural hematoma, which is a neurological condition, but also medical conditions such as ophthalmic zoster or temporal arteritis. There are certain conditions in the older population that I also talk about in my book that really should be looked at, in particular in an older individual with a relatively recent onset of headache. So there are definitely conditions there that people often do not think about,
mhm.
but certainly should be kept in mind.
And like if you were talking about the child's health, right? So if a child gets frequent headaches or migraines, so what should parents do in that case?
Also seek medical consultation.
Mhm,
Um, don't necessarily jump at, giving the child over-the-counter pain medications.
mhm,
When the child has migraine, these medications are not going to be helpful at all. That is very often also one thing that people remember. They may say, "Oh, I remember getting headaches as a young child, and I remember that whatever my mother gave me, nothing ever helped." They should definitely take it seriously, seek medical consultation for those headaches. And again, if they are intense headaches, assume that it's migraine. Very often it is known. People sometimes put their head in the sand, like the mother has migraine, but
Mhm.
the son has bad headaches, but certainly not migraine. Of course, that doesn't really make any sense. As I said, migraine is a genetically determined and inherited condition. If a parent, and certainly if both parents have migraine, which unfortunately does happen occasionally, you need to have an open eye for that when it comes to headache in your children. Um, if they are intense, assume they have migraine and seek care accordingly. If headaches occur frequently, make sure that you're not dealing with other conditions such as, I mentioned them already, anemia, iron deficiency, low thyroid function, and so on. These things occur in the adult population, but I've certainly seen them as well in children.
Mhm.
And I like to really treat, although I'm an adult neurologist, I do see children as well. When it comes to headache, mostly teenagers and adolescents. I really like to work hard for those children because I know that without the appropriate help, they may end up suffering from headaches the rest of their lives. And,
Mhm.
um, you know, that almost makes me depressed thinking about that. So I really would like to help them, especially finding effective relief of the headaches as when they get them, because suffering in a recurrent fashion from intense headaches is very bad for you. It's bad for you mentally and physically.
Mhm.
And headaches also feed on themselves. You
Mhm.
know, you suffer through a bad headache, and that already sets you up for another bad headache. So
Mhm.
it's extremely important that at an early age as possible that you find effective treatment for these headaches. And
Mhm.
again, the problem here is that most of these medications have been extensively studied in adults, not
Mhm.
in children,
Mhm.
not even in teenagers and adolescents, so that people don't know whether they can use them in those
Mhm.
age groups. Um, but I would say, you should rely on those medications. And that's also what I see when especially teenagers and adolescents continue to see a pediatrician.
Mhm.
Pediatricians are really used to working with small children,
Mhm.
and teenagers and adolescents should really be treated as adults, as far as I'm concerned, and should be given the same medications in the same dosages as we give the adults. That's what I see is a major problem, that they tend to be looked upon as children, while teenagers and adolescents should really be treated as adults, certainly from a medical perspective, utilizing the medications, the same medications that we have studied and found effective, safe, and well tolerated in adults that is over the age of 18. Uh, Doing pediatric studies, which I've done, and I'm currently doing, are very hard to do. Recruitment is extremely difficult. Um, these studies involve monthly visits. People come in and, you know, need to get a blood drawn, and you know how children are when it comes to drawing blood. They are not really out there to volunteer for those kind of things. So it's difficult to do those studies. A lot of those studies just don't get completed because of lack of enrollment, as a result of which these medications never get officially approved for the pediatric indication, and then pediatricians feel themselves limited because of that, which they should, and they should just apply those medications in those teenagers and adolescents as if they were adults.
Mhm. And like before we wrap up, what are the three most important things you would advise people to prevent headaches or migraine attacks?
Um, Basically, a recap of what I said earlier. Make sure that you get enough sleep at night, go to bed in a timely manner, get up in a timely manner, don't oversleep. Spread your activities out over the day or over the week so that you don't get exhausted. Eat regularly, 3 meals a day if that's possible. Avoid excessive alcohol. Uh, use of caffeinated beverage like coffee or soda. These are the kind of the major things I would say. And if you have frequent headaches, make sure that somebody looks at that also from a medical perspective, because there can be medical reasons why that is. It's not from chronic stress. It could be from chronic fatigue. And if you have intense headaches, again, migraine is your most likely problem. Try to understand as well as you can what brings on those headaches, but at the same time, make sure that you know what treatments are available, how these medications should be applied, and what you can expect from them, both abortively, that is the acute treatment, as well as preventively, trying to prevent the occurrence of headaches over time. Be informed as a patient, which not only goes for a headache or migraine patient, I think that goes for patients in general. Make sure you're informed so that you can maintain a good dialogue with your physician or other healthcare practitioners. And again, that's also the reason really I wrote my book, to empower patients, not only to provide them with the knowledge of what is available, but also to empower them so that they can work together with their healthcare practitioners to obtain the best care and treatment possible.
Thank you so much, Dr. Spierings, for being on my show. I think we have learned a lot about headaches and migraines today, and I appreciate your valuable time and the amazing content you have shared with us. And for the listeners, if you want to learn more, you can check out Dr. Spierings' book on headaches.
Thank you so much, Shilpa.
Thank you
My
so much.
pleasure. Thank you.
Friends, if you liked this episode with Dr. Spierings, please do not forget to like, share, and subscribe with your friends and family. Take care. Bye bye.